Good evening, ladies and gentlemen, boys and girls. This is the family program, and thank you so much for joining us on the channel on this day, the 8th of January in the year 2024. Still can say Happy New Year to everybody. And today's program actually is not so exciting because it's one of the programs that I don't like, I wouldn't like to do on a normal day, but we have to do because it's something that is affecting us, and we today highlighting on the cholera pandemic. Remember, the cholera pandemic right now has ravaged through Zambia, and we are in a situation where quite a number of districts have reported cases of cholera, and it's really it really makes sad reading. And we want to channel that effect has dedicated this particular program in showcasing what is happening in the to do with cholera situation in the country, and also ensure that we remind each other of things that we need to do in order to protect ourselves from cholera, and also protect those around us. Remember, this is an interactive program. You are free to uh, send in your comments on in the comment section, and we'll be delighted to hear from you. My name is Lawrence, remember, and thank you so much once again for being with us on Ubuntu. Now, it's important to highlight the fact that the Ministry of Health, as of today, has reported that we have had 618 cases of cholera reported in the last 24 hours, and that brings the cumulative number to 6,272 cases, and that is not a joke. That is the number of cases we've had since the outbreak was first reported in October of this year. And we can say that we've had so far, we've had 25 deaths in the last 24 hours as a result of cholera, and that brings the number to 249, which represents about 40 or about 4% of the reported cases. We've had also 452 discharges, which brings the total number of 4,858 discharges so far that have been made. And that means that we currently have 1,181 cholera patients in admission currently. And also, it's important to mention that districts that have reported cases of cholera include Lusaka, of course, Chilanga, Rufunza, Chongwe, Vubwi, Chadiza, Petauki, Lumezi, Nyimba, Mpulungu, Anakonde, Kaoma, Nsama, Mumbwa, Kapimposhi, Kabwe, Chisamba, Mkushi, Chiwuyunji, Monze district there, Goembe district, we can talk of Mazabuka, Nazongwe, Choma, Ndola, Mfuliwa, Kitwe, and also we can talk of Chilabombwe, Mongu, Nkeema, Kavumba, Kabompo, and Nkeema. Of course, the last 7 districts have just joined in the last 2 days among the cases, and that makes sad reading also. Now, for those who might not know, what exactly is cholera? Someone may ask. Well, cholera is a bacterial disease causing severe diarrhea and the dehydration, usually spread in water. Not only water though, but also food which has been left uncovered can be a potential hazard to you and those you are staying with in your family, those your beloved ones and the like. So we insist that you ensure that cold foods are avoided also, because if the bacteria is in that cold food, it's really going to affect you. Now, quite a lot has been happening, and I think today we shall pick one area that has proved to be a, an epicenter of this particular pandemic, and that is Kanyama compound. Now, we all know that Kanyama compound is not so much far away from this situation every time they happen. Reason being that probably we can talk of the sanitary conditions in that particular area, which we should at least try to work on. Now, the disaster management and the disaster management and mitigation unit, a national coordinator, that is Dr. Poland, posted a video showing us what exactly this current situation in Kanyama compound, and we bring it to you right now so that you can have an idea of what is transpiring on the ground. Let me just ask my producer to just give us a video where we are going to see the area view of Kanyama, and then we can pick up a discussion from there. Remember, you are free to leave your comments, and your views and opinions are welcome on this particular program. Let's see you on the other side. Welcome back. We hope that you can see and spot for yourself that in large portions, Kanyama compound is actually waterlogged, and now the situation there actually needs quite a serious intervention. In that, there are quite a number of households that do not have flushable toilets. We also have quite a number of households that do not have access to tap water. And even those that have access to tap water, if by any chance there is a leakage in the tap water with the situation that you can see, probably I think it doesn't help matters. These are things that maybe these are discussions we should maybe be having as a people, and this discussion should be happening actually before the onset of the rain season, because that is only the sure time that we can prevent some of these things. But as things stand, hey, things are happening. Now, things are happening. Well, we've read. I think I've presented to you the situation on the ground, where we have quite a number of admissions. But before Hero Stadium was actually designated as the cholera center, we had quite an influx, and we had quite an influx of patients rushing to the medical facilities seeking medical attention, because they are being diagnosed with cholera. And the situation that we got on the ground, there's a video that has been circulating online purporting to have been taken from Kanyama Kanyama Level 1 Hospital, where we can see quite some people needing attention. You probably have seen this, but let us just give it to you so that you can have a feel of the situation and what is transpiring in some places right now because of the pandemic.
We are appealing for help now. This is too much. No, this is what I'm doing. We need help. Otherwise, we are not going to manage like this. We don't have where to put these patients. So this is too much now. I think babale samanje manje. Odi be kenango pansa ko kalina bene. We need help, please. We have to appeal for help now. We have to appeal for help. Good morning, how are you? Otherwise, if
Thank you so much for staying with us. We are zooming in on the cholera pandemic that we are currently faced with. We actually extend our gratitude to everybody out there who is watching this program and who is sharing, because this awareness has to reach everybody, as many as possible. You never know, you might actually be saving a life. Now, uh, a few days ago, the Ministry of Health announced that they have actually designated the Hero Stadium as the cholera center, where they are taking all the cholera patients in Lusaka to Hero Stadium, and the situation there seems to be quite improved, because at least they have prepared for the cholera patient, unlike the situation that was there before. In the few weeks where having interacted with our health professionals and health personnel, we are actually having challenges on where to place cholera patients, because they couldn't mix them in the wards with others who are suffering from other ailments, and there is no hospital that currently has a designated cholera room or something like that. And it was quite a challenge, and that is why we were seeing images like the clip that we just played, and it was quite uh, sad when you as a patient do not even have where to sleep. You have to be on the floor, and somebody has to be holding a drip in their hand so that they can assist you. That was a situation, but not anymore, because the Ministry of Health has actually now prepared a place that is the Hero Stadium as the cholera center, and all the patients have been rushed there, which is actually commendable. And we thank the Ministry of Health for that preparation, and for taking some of these complaints that were coming in from various places seriously, and this time around putting things in place, and making sure that all the patients are being taken care of very well. And we get to see also the Minister of Health herself, that is Honorable Sylvia Marcel, in action right at the cholera center, the Hero Stadium there, also assisting the health personnel. Let's just give you a snapshot of that, so that you can get to appreciate our hardworking Minister of Health, who is actually running around at the forefront with the health personnel. Let's get to see it. All right. Thank you so much for sticking with us. And let's have the opportunity to welcome Ruben to Ubuntu Lifestyle. Ruben, thank you so much for finding time to be with us in the program.
Thanks and good evening to you, Lawrence, and also to our viewers.
Ruben, we are actually zooming in on the cholera pandemic that we are currently faced with, and we have seen the numbers as they are coming in from the Ministry of Health, as presented by the Ministry of Health, and what exactly is happening and transpiring on the ground. Ruben, we just saw also the Minister of Health leading from the forefront, arranging, making sure that Euro Stadium is ready for those who might contract cholera. What's your take on that?
Great. Good gesture by the minister to lead in the forefront. It's She's a minister and she's the owner of MOH as at now Minister of Health. Seeing her in the forefront gives courage to the health workers. Also, Lawrence, maybe we might need this information. All the health workers who are on leave actually were called back so that they can help out beef up the CHORELA Center at Heroes Stadium. And also, interesting stuff is some of the people that were left out in the recruitment, they volunteered to say, hey, we can help out in this pandemic. And they're there at Hero Stadium to man the clinic. And just to give you more information, as of today, Lawrence, we have got 101,181 people who were admitted, and we lost 25 people in the last 24 hours. New cases in the last 24 hours, Lawrence, uh, stood at 618 people. Cumulative cases as of today in Zambia, this starting from the time cholera broke out in Zambia, is standing at 6,272. So this is a big issue, Lawrence. But I've seen the way the government is trying to help out, especially in the communities. I've seen new tanks being erected in Kanyama and other hotspots, and also saw this Lusaka Swarage trying to help out in terms of pumping out the pit latrines in the compound. So uh, so far so good, but cholera is about uh, individual hygiene, Lawrence.
And before we even leave the area of Kanyama, we've seen the government making efforts in ensuring that they distribute chlorine as much to as many families as possible on a weekly basis. It looks like now we have a situation where people are completely depending on the government, and they can't spend a coin on for themselves for their safety.
Interesting stuff, Lawrence. I don't know. It's a mentality, okay, in Zambia where we want to depend on government for entirely everything. Uh, First, in the first instance, when you buy a plot, Lawrence, the first thing that you would think of is, where is my toilet going to be? Where am I going to get the clean water? Those are basic things that you start looking at. But all of a sudden, everyone wants to depend on the government. The government can't provide everything. I've seen today actually what they did in Kanyama. The Honorable Minister, Mr. Chinkuli, and all the councillors in Kanyama were given uh, chlorine to distribute to all the households, and they did that. They went around distributing, but for how long is government going to do that? That is the question that we need to 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 discuss here, Lawrence.
Okay. Also, one thing that we actually mentioned earlier on in the program is the fact that we have a situation which occurs every year, and we know this is going to happen, especially in Kanyama. The situation of flooding. You can also talk of the fact that quite a number of residents in that compound do not have access to flushable toilet, and also um, uh, a good percentage of that particular area do not even have access to clean water. Now, situation where we have floods, and pit latrines are a common thing. Obviously, when the area floods, everything in the pit latrines also we expect to overflow and things like that. Uh, do we look like we are even close to finding a lasting solution to some of these problems?
Or even close. I'll leave that to the Minister of Local Government, because that's something that has been going on for years and years, Lawrence. Remember, we're living in a country where everything they want to be politicized. If just the moving of street vendors, putting it in the correct, putting the vendors in the correct places, what are supposed to be, and do their trading, was an issue in Lusaka just a few months before the cholera actually broke out. I'm sure you still remember that. What of well now we say let's redesign the compounds and say we have to demolish some. That's a fact for us to achieve a better plan for these compounds. That's something that will bring a lot of politics and a lot of debate. I'm sure there's no one who wants to lose, but if you want to save a life and in healthy, Lawrence, we say if the benefit surpasses the risk, then you go for it.
Okay. We take a step forward, Ruben, and unfortunately, some people have lost lives in this pandemic. Just as the statistics that I gave earlier on, we had 25 deaths in the last 24 hours. That actually brings the cumulative number of deaths to 249 as things stand. We express our dearest condolences to all the families that have lost their loved ones to this pandemic. But the situation right now is kind of different for one particular man, Ruben. Uh, uh, let's just watch this, and then we meet on the other side and look at the quite a rare situation that he's in. Let's ask the producers just give us the next.
This man here, a resident of CHORELA compound, has been looking for his wife for 4 days now, whose whereabouts remains unknown. This is after she was admitted at Kanyama Level 1 Hospital as a CHORELA patient. Authorities at the hospital are unable to tell him at which facility his wife has been admitted to, or maybe the worst has happened. His story is not different from other residents of Kanyama, whose relatives were also admitted as CHORELA patients. He tells me he has been having sleepless nights, not knowing whether his wife, who has left him with a 6-month-old baby, is alive or dead.
Mukazi wange anadwala pa Tuesday. After hapo nanamuleta mukazi wange pa nanamuleta na ambulance pa Kanyama hospital. Nanabwera mukazi wange namuona. Balaka mali kulibe kungena. Nakama toke ndimupase namba yanga. Yeiza kulela chitika. Wantiani wantumira phone. Balaka moti get out ulibe nzeru. Na nacho kazi azelo. Following ndende kuseni. Balaka mukazi wako tunamuchosa. Tumanamuchiza kuti siwandiuza up to this time for 6 days siwa mkazi wako wena alili ubauza wakama tuzaufa kwa sales ubauza mkazi wako tuzaufa kwa sales that okay iwe as a hospital we suppose kwamba muntu patient na broke sina muone mamutenga na mpeka nako ni ku UTH mbuku mwana ita indicate kuti buroga gabwera aende kumusakira kwaso kwa tompeleka tukawoza washo kama ti sawa kama polisi chokana hapa for 6 days mukazi wangu sinza kwa nalili out of this time anisira mwana mukazi na 6 months mwana nede ndo ndi nayo pano pakanyama hospital.
Authorities are aware of such incidents occurring at some of the health facilities and are planning on putting up a command center that will have information of all cholera patients. Kanyama compound is the epicenter of the cholera disease because the majority residents depend on shallow wells for their drinking water. Sanitation also remains a challenge in the area. Republican President Hakainde Hichilema has given a directive that going forward, there shall be no more shallow wells as a source of drinking water in Lusaka and other urban areas. In the last 24 hours, the country has recorded over 300 new cases with 20 deaths,
bringing the cumulative number of people who have died to 195.
So tienti zisunge pa manyumba kupyanga mapiti latrini kufikira musha osa kumba mazi apa pali chimbuzi moti nyera mupepi futa pali kawero tapa manzi yokumwa tizipaya vantu aso.
Currently, Hero Stadium remains the national treatment center of cholera and has over 800 people admitted. Zambia.
Welcome back. Ruben, you have heard that the ministry is actually aware of such cases and they are planning on putting up a command center. Now,
yeah.
You find yourself in such a situation, what do you do?
Let's put it into context here. It's unfortunate that the man has gone in that the man is looking for the wife and is unable to trace where the wife is. This is why the problem of pandemics Lawrence, because this thing is unexpected. The inflow of the people that come to the hospital increases. The health workers are overburdened, and such cases usually happen. This is not the first time. I'm sure even the time for COVID, you had such cases came through. Actually, the command center was supposed to be one of the things that the Minister of Health was supposed to include in the plan, where the details of the patient and also the one that brought the patient or the next of kin taken down, and keep informing the next of kin of how the patient is doing and all that. I'm not so sure because most of the patients were rushed to Heroes Stadium. I'm not so sure exactly, but I'm just thinking the patient might be at the Hero Stadium.
Interesting. At least if the allegations that he's making against staff from Kanyama Level 1 are true, where he's being threatened and being called names like Cindy Okwano, things like that, Ulibenzelu and the like, it's difficult to ascertain, I know, if what he's telling is true or probably is adding some exaggeration to the story. It's very difficult to tell and cannot verify that it's actually the correct position of what transpired. But
Lawrence, just a minute, and you brought up one thing, was I wanted to hear also from the side of the institution. The Minister of Health has got a spokesperson or someone who would have stood and spoke on behalf of the institution. I don't know why the reporter didn't ask that. The reporter was with the minister, so the last party was with the minister, Tiros. I couldn't alert the minister this is what is happening there, so that it's easy for the people that are watching the news to get both sides of the story. But we've only heard from one side of the story, and him saying the authorities are saying that who are the authorities who issued that statement. So somehow the story is not complete and it's one-sided.
Thank you so much for that. Thank you so much for that. Remember, we are actually looking at the cholera epidemic and this breakout, and especially in Lusaka, where we are witnessing quite a number of deaths in a day. It's all about taking care of yourself, and that is what cholera is That's what prevention is all about. But Ruben, looking at staying on the subject of those who have lost their lives, we just want to remind our viewers this clip has been circulation as information on social media for quite some time. That this is a crisis situation. Probably when some of us can see these pictures is when we believe that actually things are happening. Let's just take a look at uh, what is happening when it comes to deaths. Again, we sympathize with those who have lost their life, who have bereaved at this point in time.
inataka kutembo kwa shida baposa mwe so pano mbani ba abene ba city council ba eba kuyangushika senda wali nyina uli palya chowera mwe so what you are very serious now. So whatever you have documents, abafu mun pa George Lombalinya. So bachasenda matero bachasenda so itraki kuya nomba mkushika uno wino ushiko. They are going to bury the city council, so that's how it is.
Unfortunate scenes there, Lawrence. Right. So if you are joining us, we're giving you just the update concerning cholera in the nation of Zambia, starting from 2023, somewhere early January, is it early March, April, somewhere there, we started reporting cases of cholera. I know some of you might have forgotten, but we started with eastern part of eastern province, starting with Vubwi. Vubwi reported a lot of cases of cholera early this year. Remember, we had cholera in Malawi, and there were some cases that were also reported in Vubwi, eastern part of Zambia. But now it's full blown, and the epicenter is Kanyama and also George. We've seen a lot of cases that have been reported, and surprise, and the big number of people that the minister is saying they are dead. Most of them are BIDs, brought in dead. Most people are keeping these patients at home for a long time, for a long period of time, and then people now, when they come to the health facility, they are not okay. They've lost a lot of fluids. By the time the health personnel are trying to attend to the patients, it's too late. And let me just give you the updates in the last 24 hours of what transpired. So in the last 24 hours, new cases were 618. That's new cases in the last 24 hours, 618. These are a lot of cases, and deaths today, the last 24 hours, stood at 25. Discharges, those who have been discharged from any of the centers that are keeping these patients, stood at 452. People were discharged today, and in terms of admissions, new people that have been admitted in the last 24 hours stood at 1,181. Right, Lawrence is back. Hope you're able to hear me.
Okay, thank you so much, Ruben. Apologies for that internet breakdown over there, and thank you so much for sticking with us. Now, Ruben, imagine in this pandemic, the way things are right now. Then you have community, you have a community waste disposal site right in your doorstep. How do you live like that? This is the story of one woman in Ngwenya area of Kafue district, who has actually been living with the dump site right on her doorstep. And this is actually what is transpiring. Let's just watch this clip.
Ndize kupisa papata unakwenda ngusini ngibothe vele nawo nokwekela ngona vele nokela sini ngibothe so tumbuko ukuthi tazibuza pasi papata mtandize kuba kansi tazibuza pansi
chose ekyo kibwera ku nyumba uku so tambeera abakanso bakitapiwo bamayi aba kuti mubatandizireko otherwise sirimu situation sirimu situation otherwise do something bakanso. We have confidence in you. I know you'll do something.
Okay, welcome back. And Ruben, that is the situation for this particular, that has been the situation for this woman whose yard has actually been turned into a dump site, and could spot vehicles from Langa district, from Lusaka, are going to dump garbage right there. The smell out on the site, Ruben, is unbearable. You can't, it's not possible. You can't even be comfortable in that particular area. What kind of what exactly is going on in her mind, if you can imagine, Ruben, looking at the pandemic that we have already?
Interesting stuff, and I think the big question is how come the council has been allowing that going on for some time, and watching us actually standing fit and speaking, Lawrence, I'm surprised, because looking at the condition and looking at where the house is, those flies, and she's not sick of cholera. That's a surprising thing. We need to thank God for that. But these are some of the things that we need to avoid, Lawrence, if we were to win this fight against cholera. In the first place, you had said that this is more like a traditional ceremony. It happens annually every year. Because of such issues, I think we've got enough laws that protect and govern us how we should live. That area is a residential area, and there was no way that dump site should be located just not even at close to her house, Lawrence. That's inside her house, Lawrence, because the flies are all over, the smell is all over. So this is something that the council should attend urgently, and as the council is well equipped with a department of public health. They've got people that know these laws. They know how a residential area should be designed. They've got planners. So this is something that the director of public health in you said that's Kafue, right? That's Kafue district should do should put as priority or P1 on their agenda this year? Not this year, this week.
Um, um, the unfortunate part, Ruben, is when she explains how she even has to keep food safe from flies. She has to cover it under a mosquito net because to prevent flies from sitting on her food. That's just how tragic it is.
But it seems this has become a new normal in inverted commas because if you pass through Chingwere dump site, this side in Lusaka, there are houses there, Lawrence. The same story again. That area when you're passing through near the graveyard, just few meters away, there are houses. I don't know why the council cannot enforce the law. I don't know why and how they designed these dump sites. Because as far as I'm concerned, where the dump site is and the residential area, there should be some good kilometers so that the people are not affected by the flies, by the smell, and that's not so their water is not contaminated. Their underground water is not contaminated.
Well, I think it's important to make mention that when contacted for a comment, the Kafue Town Council has actually stated their position at this point in time to say they have now closed that dump site and will move on site within this week to ensure that everything that is there is removed and a new dump site has been found. That is the situation, which is a good news, Ruben, and probably I can give you a chance to react to that.
I know you call it good news. In health, unless you do something, that's when it becomes good news. So for now, it, the condition is still not safe because a person can still get infected within seconds. So in public health, something needs to be done now and then. That's 1 week, no in days and all that. Lawrence, in a pandemic, you don't take time. Within a second, someone can get sick and die. Remember the numbers that we are reporting. For me, there's nothing that the council should even wait for. Close that area now. Just close the area.
Okay. Ruben, I'll just let's just as we are winding up, I want you to just share again with our viewers the guidelines on prevention of cholera, what they need to do. Please help me go through those things as you also give your closing remarks, then we can wind up.
Simple, Lawrence. One, make sure you wash your hands with soap regularly, Lawrence. Not just when you're about to eat food. That's where the problem is with Zambians. The only time we think of washing hands is when you want to eat something, but that's not the practice. But it's regularly. After some few hours, you wash your hands. After some few hours, because you want to disinfect your hands now and then. You don't pass the corridor when you're greeting and all that. So avoid greeting. Avoid the chilangamlilos, Lawrence. This is the time, not a time to attend chilangamlilos. It's not a time to attend weddings anyhow. No. Actually, I was wondering why they have not discouraged the some gatherings. Such things are supposed to be discouraged this time. Make sure that your toilet is clean, Lawrence. Make sure that the toilet is clean. Eat hot food, and if you have got any leftover food, make sure it is well covered. There are no flies there, and when you want to eat that food, make sure that you warm it. Thanks,
Okay.
Lawrence. And let me give my closing remarks. My closing remarks are very simple. Cholera can only be won with personal hygiene.
Okay, Ruben, there is an interesting question which reads, can you, in case you are not able to wash your hands at a time, is it okay to use hand sanitizer? Does hand sanitizer work for the cholera bacteria?
it, it Lawrence, it does. However, when you have a pandemic, there are a lot of people that come up with a lot of hand sanitizer and all that. So don't depend on hand sanitizers.
Okay, thank you so much. Much appreciation to you, Ruben, for finding time to join us on this special edition of Ubuntu Lifestyle that was dedicated to cholera. Remember, we must win this fight, and we want to urge everybody, regardless of where you stay. You might not have cholera outbreaks yet in your districts, or maybe it's not yet there. It can always start if you remain careless. So take care of yourself. Your life is in your own hand. Cholera is very deadly. If you possess signs of diarrhea, please rush to the nearest health facility for assessment, and you'll be assisted there. All health facilities are actually very much aware of what is happening, and they will be able to help you in such cases. Also, I'm told in Kanyama they have planted some ORS centers in case you are having diarrhea and losing a lot of water. You can simply go there and they'll give you a cup of ORS already made and waiting for you. Use all these facilities that have been put in place, or these services that have been put in place by the Ministry of Health, and ensure that you stay safe, which is the most important thing. Have a good night, and thank you so much. Remember, you'll catch us tomorrow on Political Tuesday right here on Ubuntu channel starting at 20 hours. Good night.
Good.